thank you so much for joining us today. It's been a heck of a session for you to be brand new to this job as the director of the Department of Health and Welfare. How did those first 3 months go for you?
Well, when I took this job, they told me it would be busy during the legislative session, and they were correct. So it's been very fun, actually very intriguing, very interesting, and it's been very fast.
Now that we know that the governor has signed the Medicaid expansion work requirements bill, there's no more negotiating, there are no more changing details. Can you walk me through exactly what Medicaid expansion would look like if the federal government approves all of these waivers and this bill goes through and is implemented as lawmakers intended?
Sure. The first thing I would say is that Medicaid will expand on January 1st, 2020. This bill doesn't change that approach, and it's actually specifically written in the bill that that will happen. In the bill are a number of changes for that expansion population, and I'll just walk through those at the highest level. The first is today we give a health risk assessment to people as they come on to Medicaid. This bill directs us to add some questions about substance abuse disorder or those that have an addiction problem, and then we will direct them into services. So we want to catch that early so we can get them into services to help them treat that condition. The second thing and this isn't necessarily in order, but the second thing this bill directs us to do is currently Medicaid is not able to pay for inpatient mental health hospitals, and this bill directs us to seek a waiver so that we can actually pay for inpatient mental health or behavioral health in those hospital settings. Another thing this bill does is it directs us that for those, and when I say us, I mean the Department of Health and Welfare, that for those individuals that are between 100% and 138% of federal poverty level, they get to stay on the exchange, or their first choice is to be on the exchange where they can receive a tax credit. And if they choose not to do that, then they can choose to move on to the Medicaid coverage.
So it's less of a passive automatic sign up for Medicaid expansion if they're in that population, and more they have to opt in.
That's correct. So their first choice would be that they're on the exchange and eligible for those credits. They would have to choose to move over to Medicaid.
Got it, got it. And then there's the work requirement.
And then there's work requirements, yes. And so the work requirement is in this bill, and that work requirement indicates that an individual has to be working the equivalent of 20 hours a week at minimum wage, averaged over a month, or doing one of two other activities, which is volunteering for an equal amount of time of 20 hours a week, or being enrolled in an educational institution of some type, at least part-time. And they have to be doing that for monthly. And this bill then directs the Department of Health and Welfare to check every 6 months with those that are on Medicaid and that are eligible for being checked on for work, and I'll talk about that in a second, to make sure that that's taking place. There are some exemptions. Actually, there's quite a few exemptions for those that the work requirement does not apply to. It would be folks with disabilities, folks that have physical or mental conditions, folks that have a child at home that they're taking care of. There's a number of exemptions in there where the work requirements would not apply.
And as you alluded to at the beginning of the interview, this isn't guaranteed to go into effect because you have to apply to the federal government for what's called waivers, right?
That is correct. So for each of these items in this bill, we will need to apply to the federal government. We will submit an application, so to speak, to say we would like to do something different than the normal Medicaid rules and regulations, federal rules and regulations. That will then enter into a process essentially of negotiation with the federal government to see if they're going to approve those or in what form they would approve those.
And what's the timeline on submitting those waivers and figuring out what the federal government's going to say?
Well, a good rule of thumb is that generally a waiver takes about 12 months, and that is because it takes us some time to actually write the waiver. They're actually very complicated. They take quite a bit of analysis to do these waivers. We would then submit those to the appropriate federal agency, and then the agency would review them, usually for a period of about 6 months or so. And then we would then enter into a negotiation phase to decide if it's going to be approved, what the final approval would look like. And so that's kind of the rough time frame.
So what you're saying is there is a good chance that we're going to have clean Medicaid expansion rollout on January 1st, 2020, and then if the federal government approves the work requirement waiver, then have a secondary rollout a few months after that initial rollout on January 1st?
Yes, essentially. So the way the bill is written, let's assume the waivers is not approved on January 1st. We would roll out Medicaid as it is to 138% of federal poverty level. let's say we then get the waiver approval in, let's call it March, which would be a kind of a normal timeline, about 12 months, then yes, at that point we would implement the work requirements on the Medicaid expansion policy, or population, excuse me.
There was a lot of discussion in testimony saying that they were concerned that this is going to attract a lawsuit.
Mm-hmm.
You know, in other states, judges had concerns about work requirements. What happens then if there is a lawsuit and a judge puts a stay on the work requirement? Is there going to be the tertiary rollout in that case?
Actually, the sponsors of the bill has actually anticipated that. And so what is in the bill, it says if the work requirements that deny eligibility are determined to not be appropriate or legal, that we would then fall back with a work requirement would still be in place, but instead of losing eligibility for Medicaid, those folks that do not meet the work requirement would be paying copays instead.
That sounds like it's going to be confusing not just for your staff and your administrators, but also for Medicaid recipients.
We anticipate that if we end up in that scenario, there will be a need to provide a lot of communication, not only to participants, but also to medical providers who will need to check eligibility. And if we went up in copays, we need to check whether that individual is making a copay or not as well.
Do you think lawmakers understood that we might not have an answer when Medicaid expansion goes live on January 1st, 2020?
Yes, I do believe that legislators understood that. And actually contained in the bill itself, it says that whether these waivers are approved or not, or finished or not, on January 1st, 2020, Medicaid will go ahead and go live for those that are eligible up to 138. So there was a full recognition that this process, A, could take a long time, and B, may result in some waivers that are not approved. And so they wrote into the legislation to, if that happened, that Medicaid would go ahead and expand.
And a lot of the discussion was very political surrounding the work requirements and the reporting mechanisms. But when it comes down to it, it's a very administrative task for your department. How much of how that is going to be administered and figured out and measured is up to your folks at the Department of Health and Welfare?
Well, a lion's share of it will fall on the Department of Health and Welfare to administer the requirements that were laid out in this bill. And that's one of the tasks we've been working on over the past couple of months, and really our obligation, it's in the legislative process, is to let them know what that looks like so they can make choices about what they want to do as a result of that. But we are gearing up to both file these waivers, but also be prepared to administer those waivers should they be approved.
And I know that there were a lot of questions in committee and during testimony about what happens if, say, I'm a freelance worker and I don't have a traditional way of measuring my hours, or I get the flu and I miss a week or two of work. Is that going on? Is that kind of discussion going on as you're talking about applying for these waivers and getting ready to write these rules should they be approved?
Absolutely. We're just at the beginning of that process. But we'll take into account the exemptions that were provided in the bill itself, which are similar to other federal exemptions for other work programs that exist. And then we'll be thinking through exactly those details of how we both manage those types of situations and how we get reporting for those types of situations.
Now, when the Joint Budget Committee met on Tuesday afternoon, there were some questions that came up from the minority party about how much this process would cost the state. Are you comfortable with the fiscal note that was attached to the bill?
The fiscal note that was attached to the final bill and went to the Joint Finance and Appropriations Committee earlier this week, we feel very comfortable with the estimates that were put in there on the administrative side. What we're really focused on there was the cost of both preparing the waivers and then administering the waivers, assuming that they were approved. They are just estimates. Those numbers could change. For example, we could learn early in the process that a waiver is not going to be approved, in which case that cost would be less for the waiver itself and there would be no cost to administer clearly. Or we could learn through the process of negotiating that it's going to take longer, which would both raise the cost of preparing the waiver and, depending on how it comes out, could raise or lower the cost of actually administering them. But for the best of our knowledge with the current language we have in the bill, those are our current best estimates.
Now, we've talked so much about rules, and of course, one of the big stories from Sine Die was the legislature did not extend those administrative rules through the next fiscal year. How much uncertainty does that put on the Department of Health and Welfare?
Well, given the timing of this interview, that news just broke literally a few minutes ago. And so that's an open question for us. We do have a number of rules at the Department of Health and Welfare, and we'll be looking for guidance from the state agencies over rules to help us understand what that means and how we move forward from there.
Now, so much of the discussion this legislative session has really focused on Medicaid expansion, but what else changed for the Department of Health and Welfare in the 2019 session?
You know, it was actually, other than Medicaid expansion from a legislative perspective, it was actually a relatively quiet session for us. There were a few changes that were made through bills that were passed. One is a maternity mortality panel was created, and that's something that we'll be picking up and focusing on. There were a number of rules that we had proposed that were then approved by the legislature, but relatively, other than Medicaid expansion, it was a relatively quiet year for us legislatively.
And those rules, going back to our discussion, they were approved by the House and the Senate, but not permanently extended. So are they still in effect?
I have that same question. We'll find out hopefully in the next 24 hours.
All right, Director Jeppesen, thank you so much for your time.
Thank you.